and
The American Health Journal, bringing you the latest information on medicine, psychology, diagnosis, treatment, and prevention. Major medical advances are made each week, and each week the American Health Journal keeps you up to date.
Hello and welcome to this special edition of the American Health Journal. I'm your host, Roger Cooper. In this special half hour, we'll visit the Gordon Weiss Vision Institute in San Diego to bring you the latest developments in lens implants for cataracts, and we'll look at Lasik procedures for the treatment of presbyopia, a common condition in people over 40. We'll follow an actual procedure from pre-surgery to post-surgery and speak with the patient. The Vision Institute surgeons perform over 10 different vision correction procedures at their accredited surgical facility, and they're recognized worldwide for their clinical expertise. Gordon Weiss Vision Institute has an exciting new procedure, a procedure they alone have exclusive rights to perform in the United States. It's called PML, or Progressive Multifocal Lasik, for treating presbyopia. We begin our program with one of the founders of the Vision Institute, ophthalmologist Dr. Michael Gordon, who explains presbyopia and the options available to correct this condition, and the newest procedure, PML.
Presbyopia is the naturally occurring decrease in your ability to read as you get older. It's basically where your eye has the ability to what we call accommodate, and that is change its focus from far away to close up. That's the process that we all lose as we get older. We have a natural crystalline lens inside the eye. That lens, when we're younger, is flexible. It's able to move and change its focus by changing its shape. As we get older, the lens gets more rigid and can't change its shape, so you lose your ability to change the focus. Typically happens somewhere between the ages of 40 and 45 is when it starts, but it can happen as early as 35 and in some people as late as 50.
We asked Dr. Gordon what options are available.
For presbyopia, there are certainly non-surgical options. Conventional options that have been available for a long time, and that's glasses and contact lenses. The other options are surgical options, and we've had a number of surgical options that have developed over the years. The first that's been around for a long time is monovision. Now, monovision is where you correct both eyes for distance, but leave one eye a little bit nearsighted, so you get what's called blended vision. Your brain puts that image together so you can see here and you can see far away. Monovision can be accomplished whether it be via Lasik, via PRK, which is surface ablation. Another newer technique is CK, or conductive keratoplasty, which uses radio frequency energy to accomplish the same thing.
How was PML developed?
PML stands for Progressive Multifocal Lasik. It was a procedure that was invented by a student of mine in Italy who came here and studied with me, went back and has been doing it for the last 5 years, and it's where you actually correct the distance vision and then add another curve to the cornea so the patient can read. The advantage of this procedure is that both eyes are corrected for distance and both eyes are used for near. And it works by giving you a depth of field, so it's different than monovision. It doesn't affect your depth perception, it doesn't significantly affect your distance vision such as monovision can, and we were convinced that this is a very viable, very good procedure, to the point that I did this surgery on my wife about 3 months ago. She hated the fact that she couldn't see things. Couldn't see her cell phone, couldn't sit at a computer, couldn't do anything up close. So she was looking for something, and we kind of waited until we had a procedure that we thought was the appropriate procedure that was good and safe, which we think PML is.
I was just thrilled beyond belief. I was just picking up things and reading the very smallest print on everything, and I just was so excited, and it was such a thrill to not have to worry about my glasses. It was liberating. I felt younger. It was, back in the day where someone shows you a picture or there's a menu or something in a book and you don't have to say, wait, let me get my glasses. I definitely wasn't going to be one of those people with the glasses around my neck on the chain. So this was a really good thing.
It's a newer procedure, a procedure that we're doing here exclusively in the United States. My office manager, Cindy Haskell, had this about 4 or 5 months ago.
Before I had my PML procedure, I couldn't see anything. I couldn't see the food in my plate. I couldn't see the computer. I relied on reading glasses or progressive lenses for everything I did. And it was a constant reminder of getting older. After my surgery, I woke up the next morning and I could see out the window in the back of my house, clear out to the mountains. It was absolutely great. And then I came in for my one-day post-op visit. I was able to read everything up close. They handed me a newspaper and I could read the newspaper.
We asked Dr. Gordon if PML is safe.
It's a safe procedure, it's an effective procedure, it's wonderful, it gives people what they want. And I've gone all over the world teaching and learning new techniques, and I can tell you that over the course of the last 20 years, this is probably the most exciting thing I've seen. Because presbyopia, even, it's not a life-threatening disorder, but it threatens your quality of life.
We asked Dr. Gordon if people who've had previous laser surgery also can have PML.
People who have had previous laser surgery can have PML. There are certain criteria we look at, meaning what was their previous prescription, what is the shape of their cornea currently, but the answer to the question is yes.
What will this procedure actually do for the patient?
I think the important thing for people to understand is that the level of vision you're going to get with this is going to give you functional vision so you can get around and do the things that you normally like to do. It's what I call getting around near vision, meaning you're going to have excellent or good distance vision to do all the things you would want to do sports-wise, activity-wise, and it's going to give you a level of near vision so you're functional, meaning you can read a paper, you can sit at a computer, you can read a menu, you can see your cell phone, you can see your wristwatch, you can go shopping, things that when you're out and about, you don't want to have to be reaching for reading glasses.
How soon can patients resume daily activities after PML?
Like all laser surgery, the patient literally can go back to work the next day. I mean, most people, they come into the office the next day, they're seeing somewhere with this procedure, somewhere between 20/20 and 20/30 a distance, and they're able to read, see their computer, they're ready to go to work.